Your eyes and your vision are under attack, damaging blue light from the sun. Your phone, your computer, your tablet, even light bulbs and car headlights is constantly bombarding you. The good news is our eyes actually already have a line of defense to counter the effects of blue light. This defense is made up of 3 pigments called carotenoids. MacuHealth with Micromicelle, the only supplement with the exclusive patent on all 3 macular carotenoids and Micromicelle technology.
Do your patients know what presbyopia is?
There are people who are afraid of the press.
Have you talked to your patients about multifocal contact lenses?
I've heard the bifocal, but not multifocal.
Exactly, not multifocal.
Do you need help with your multifocal strategy? Learn more at the conclusion of this episode. With more screen usage and indoor time, myopia, also known as nearsightedness, is increasing and getting worse in children. Now, certified eye doctors can prescribe MiSight One Day, the first and only FDA-approved soft contact lens to slow myopia progression in age-appropriate children. Visit CooperVision.com to find a Brilliant Futures certified eye doctor near you.
In 1972, Matt Christopher wrote his most famous of his 140 books, The Kid Who Only Hit Homers. It was not only his best-selling title, but it also was his personal favorite and his dream to turn it into a film one day. Through the efforts of his sons, Dale and Dwayne, and producer Wayne Chesler, that dream finally happened in 2020. Oh, and that's me, Alex Montero. I played Sylvester Codman, the kid who only hit homers. During the production, I would ask Dale and Dwayne, where did it all begin? Why did the ghosts of Babe Ruth come back and teach Sylvester how to hit homers? Well, it was a secret till now, and my mom asked me to finally share it.
Welcome back to part 2 of my interview with radiologist Dr. Anna Rosa. In part 2, we continue our visceral fat discussion, and Dr. Rosa educates us with actual MRI images. If you're new here and you like our interviews, press like, subscribe, share, and hit the bell. Also, please leave comments. Be sure to watch our full-length documentary, Open Your Eyes, on Amazon Prime, Apple TV, iTunes, Google Play, and YouTube Movies and Shows. Okay, let's cue up the slides and teach our audience, and there's a lot of physicians that watch this, how to diagnose visceral fat. And while you're queuing that up, when we talk about, and a lot of it, what we talked about now, what causes is the same thing, the strategy we're going to use to reverse it. I really want to talk at some point the difference between sprinting and long distance jogging, and why long distance jogging really is detrimental, will increase visceral fat and lose muscle, and where sprinting, and the sprinters are the healthiest. And I want to, if you, number one, do you agree with that?
Yes, from the clients and experience from Sean that he shared with me. So we have different kinds of muscles in our bodies, muscle fibers in our bodies. And one fiber is the slow twitch, and the other fiber is the fast twitch. When you run, you are using your slow twitch muscle. And when you use one, you do not use the other one. It's like very much, right? You do, but not very much.
When you jog, you're talking about.
Yes, when you jog or when you run, you are using slow twitch muscles. And these are muscles that these people also have a greater chance of having more visceral fat and sarcopenia. When you are sprinting, it's considered more than a high intensity form of exercise. It's even higher than high intensity exercise. And you are improving your nitric oxide, and you are improving your circulation and vascularization in your body, and you build muscles faster, and you are building the fast twitch muscles. And when you are burning muscles, you are also utilizing the glucose and everything else better, and you are decreasing your visceral fat. So it's shown that the sprinting people or the high intensity exercise people, they are building fast twitch muscles. They are improving the utilization of oxygen, and they are improving the utilization of nitric oxide and vascularization. Hence, they have more, they have less visceral fat and less sarcopenia and more muscle bulk. I am not an expert on that subject, but that's what I have seen from Sean's clients and his own research, and from my research by looking at Google and ChatGPT. So that's not a medical foundation that I'm talking to you right now. Very, very medical foundation like the other information. Yes.
So show us what to look for visceral fat. I know that you have slide number 8, where you have a lot of people with the same BMI, but they have different amounts of visceral fat. I think that's slide number 8, if I remember correctly.
So here we have, is it good to see?
Yes, and I can see your pointer, which is great.
Okay, so here we have the BMI. It's 24, so it's a normal BMI. And we can see the huge difference from this image, which is a normal BMI, but minimal or none visceral fat.
I'm sorry, doctor, just explain BMI for a second so the audience that doesn't know what BMI means.
Okay, BMI is body mass index, and it's calculated by a ratio between your weight and your height. And I don't know the numbers, all the numbers, but when you have a normal BMI, you are not considered obese and you are considered healthy. I know that BMI greater than 30 or 35 or 40 are obese people, but again, I don't know these numbers because I don't look at my number. I only look at my number and I know, okay, I am not healthy yet. But this BMI is the BMI that it's for normal people. So in this case, in this particular study, they looked at normal weight subjects, and they were checking for the amount of body fat or the amount of visceral fat. So this person here is completely different from this person here. So this person is a thin inside and thin outside, metabolic healthy. And we have the muscles and we have the organs, and you see minimal fat.
I'm just going to interrupt for 1 second. I just want the audience to know that this is a BMI of 24, which would be considered normal. So your doctor would say, you're normal, you don't have to worry about anything. But here are patients that all have the same BMI, and you're going to see that, and Dr. Rosa is going to explain why some have a lot more visceral fat, and they're really not healthy. So go ahead. I just wanted to clarify that.
So then we keep moving from one patient to the other, and you can see how this white here inside the belly is increasing, and that's the visceral fat, and also the amount of subcutaneous fat, but we are going to focus on the visceral fat now. So it's the same BMI, so it looks like a thin person, healthy person, but the white is increasing inside your abdomen to the point we get to this last patient here, this last person here, and you can see lots of white, completely different from the first one, and less muscle bulk too, as you could see. And this is a person that believes he's healthy. The doctor tells him he's healthy, like Dr. Gelb said, and he looks at him and he feels like, okay, I'm skinny, I'm fine, but this is a metabolic, unhealthy person. This person has lots of visceral fat and hence this person is going to have a lot of inflammation in their bodies. And that's why it's important to have an MRI, because then you see that, yes, I am skinny, but I have lots of visceral fat, and I have to work on that and reverse this visceral fat and reverse this inflammation to build an optimal life. And you only can see that on the MRI. But like if you go to your ophthalmologist or optometrist and they look in your eyes and they see changes that indicate inflammation, or if you have a glucose and it's high, or if you have an insulin test and it's high, or if you have any kind of test that might be a little bit abnormal, and you're going to do your MRI and you're going to be surprised that you have this fat. And this is what I'm talking about. Like,
Dr. Rosa, if you could go back to that slide one more time, just explain to us, where is the slice? Is it horizontal? Is it vertical? What part of the body is it?
So the slice is axial, or horizontal cut, like as if I'm cutting my head, whoop, from front to back. So I'm looking at the body like that, from up to top, up to down. But the slice is transversal to our bodies, relative to our bodies.
And this is the abdomen?
And this is the abdomen, and this is the level of the belly button. Here, this indentation here is the belly button. So this is the level of the belly button, which probably will be L3, L4. Yes.
Thank you.
L4, yeah, L3 to L5. So, and that's what I'm saying. When you look at these images, you see, so thin inside, fat inside, thin outside, fat inside, which are the tophies. Thin outside, fat inside, which are the tophies, and they are metabolic unhealthy. And that's what they explain here. Like you could be metabolic healthy with normal weight and no visceral fat, low visceral fat. So the BMI is normal, less than 25. So low subcutaneous, low visceral, insulin sensitive, low metabolic disease, healthy, metabolic healthy, normal weight. And then you have the on the other extreme, you have the metabolic unhealthy, which is overweight, high BMI, high visceral fat. So the amount of visceral fat is what determines if you are going to be healthy or not. How healthy you are or how unhealthy you are is the amount of visceral fat. Because you can see here both greens. One is thin outside and the other one is fat outside or obese, but they have low visceral fat, green. So they are metabolic healthy. They have very little inflammation going on in their bodies. However, if you are obese and you have lots of visceral fat, or if you are thin and you have lots of visceral fat, the visceral fat makes you insulin resistant. The visceral fat makes you at high risk for metabolic disorders, and you are metabolic unhealthy. And that's what you have to do in MRI to be able to see where is your fat located, what kind of fat you have, how much fat you have, so then you can get to understand, yes, I don't have any visceral fat and I'm fine. Oh no, I do have lots of visceral fat and I'm sick without even knowing it yet.
And you have a good before and after slide you could show us?
I do. I just want to show you one thing too.
Sure.
The fat in your muscles. So this is a normal muscle, bulky, gray, and again, the fat is white. So you have all this fat interspersed in your muscle fibers. And this is the myosteatosis or fatty replacement of the muscle. And this fat is also inflammatory.
And that's
before and after.
That's marbleization of the muscle.
That's marbleization of your muscles. Yes. That's what the cows that eat grain, they look like that. And that's why they tell us, you have to eat whole grains. No, we do not have to eat whole grains because whole grains make the cow's muscle be marbleized and they make the cows fat because you want a fat cow for you to sell it. So whole grains do the same with us. They make us fat because it's carbs and they marbleize our muscles. And we don't want that. We want healthy muscles, active muscles that will be able to sprint and run away from the stress.
And what are those big white spots, those two white spots, the big ones?
This is the tibia and this is the fibula because these are these are images on your calf, on your lower extremity.
Thank you.
You're welcome. And this is a case that we see fat in the liver. Look at how horrible. Like this is a sequence that shows when the signal, which is called signal on MRI, gets darker or drops, it signifies that you have lots of fat in your liver. So this is pre or in phase, and this is out of phase. And you see how dark this liver got, completely diffuse dark. It's because this liver is diffusely and severely infiltrated by fat. And again, you can see that it correlates with the amount of visceral fat because you can see lots of visceral fat here in the abdomen, which is this white beneath the musculature. So lots of visceral fat, fatty liver. And then I'm going to show you another tophy. So this is a good person. This is a scout view. And you look that this person is thin, right? Very little subcutaneous fat, looks like a skinny person. And it is a skinny person. Fat inside as well. There's no fat surrounding the heart. This is a CT, unfortunately, but there is no fat surrounding the heart. And there is minimal fat there is no fat, no visceral fat in the abdomen. And then you get to another person who looks like as if it's kind of thin as well, skinny, you know, a little bit more visceral subcutaneous fat, but still looks like skinny. Look at how huge is the amount of fat that this person has surrounding the heart. That's the ectopic fat.
So with CT scans, the fat is gray, not white.
Yes.
It's gray. And you get radiation from CT scans versus an MRI. Is that correct?
Yes, and that's why we prefer the MRIs, because the MRI, the fat is going to shock you more with the vision in the T2 sequence, because the fat's going to be white, different from the fat on CT, which is gray. There are MRI sequences that the fat is gray as well. But for visceral fat, to show the clients and to quantify, we prefer the T2 sequence, and for that sequence, the white is fat. And MRI does not use ionizing radiation, while CT would use ionizing radiation. But why I'm showing this here is because if you or any of your followers have any scan that they have done in the past, you know, recently, you could go there and ask for a copy of your scan, and you're going to be able to look at your images yourself in your own home computer and check, do I have fat surrounding my heart? Do I have fat in my abdomen? Because if you do, and chances are that you're going to be in the 95% of us, chances are that you're going to have visceral fat, ectopic fat surrounding your heart, and visceral fat all over your abdomen. So again, this ocean of fat, and the organs like the bowel, the stomach, the gallbladder, the liver, the spleen, the kidneys are all floating there. Not deformed, but floating and suffocated by inflammation. So you do not want visceral fat, the white in your abdomen. You want like that, minimal visceral fat, and muscles and organs, minimal visceral fat. I'm going to show you my MRI from 9 months ago, before I started. I feel sad to show that, because I feel sad, but I also feel happy to share that, because I am on a journey. So we are all in this journey of life. So each day is a new day to take a step, make a different choice, make a decision, and use the knowledge to put into action. Because you know what? If you're listening to this podcast and you're getting like, oh, that's awesome, and you're not doing nothing, and you're doing nothing, I'm sorry to tell you, knowledge is not power. Knowledge is what's gonna give you it's gonna give you something to propel you to action. Power is action. Power is saying, I'm sick and tired of being sick and tired, and I'm going to make different choices, and I'm going to make different decisions, and I'm going to get healthy no matter what. And it doesn't matter if I want to do it, and it doesn't matter if I don't feel like doing it, I'm going to do it, because I'm the boss of my brain. And after you do it, the energy will overflow your heart, and you're going to compliment yourself and say, we did it. And tomorrow you do it again. And then the next day you do it again. And you're going to start seeing results, because the results are not going to be immediate. Especially if you have lots of visceral fat like me, the results will take time, because you have to reverse inflammation. So then you start burning visceral fat together, and you're not going to build muscles that fast, because while you have visceral fat in your body in significant amounts, the inflammation and the visceral fat are really not helping the muscles. But as you start burning and reversing and getting better, then your muscles will have an environment that will make them thrive. And that's when you're going to build muscle better. So here it's 9 months ago, lots of visceral fat, lots of subcutaneous fat. And that's what I was talking about. If you look at this thin gray line here, I hope you can see, that's the scarpus fascia. And that's what separates. So this is my skin, and that's superficial subcutaneous fat. Superficial subcutaneous fat is protective, produces adiponectin, decreases inflammation, protects against cardiovascular disease. And bummer, below the scarpus fascia, I have this huge amount of deep subcutaneous fat. I had deep subcutaneous fat. Deep subcutaneous fat goes from the scarpus fascia to the abdominal musculature. Visceral fat goes from the abdominal musculature inside, all the white. So lots of visceral fat, lots of deep subcutaneous fat, lots of inflammation, asthma, rosacea, eosinophilic esophagitis, sleep apnea, bad sleep, headaches, brain fog, you name it. I had all of this. And you can see my muscles here, and I want you to pay attention here. How my oblique musculature in my walls are marbleized. You see all these white streaks. So I started Sean's strategy for 9 months, really committing. And you can see how my visceral fat already decreased. I'm going to go back, okay? Visceral fat, visceral fat. It has already decreased. It is still severe, but it has already decreased. And if you look at my muscles, you can see that the marbling decreased as well. There is less marbling in my abdominal wall musculature. So I am building muscles, I am burning visceral fat, and I am decreasing inflammation in my body. So that's what you do when you eat like that. This is Sean from Sean O'Mara Instagram, and that's what we eat. Grass-fed, grass-finished beef, and fermented veggies, fermented fruits, kefir, butter, lard, no margarine, no processed foods, no preservatives, no seed oils, no vegetable oils, fermented foods, fermented veggies, fermented cheese, fermented dairy, raw milk, grass-fed, grass-finished beef, pastured eggs, pasture-raised eggs. That's what I eat, and that's a beautiful picture from Sean when he was preparing his meal. And the other strategies that we're going to talk here, but the other strategies that are walking, strength training, sunset, sunrise, sunshine. Yeah, and then you get better. And he has patients that had narrowing of the lumen of the middle cerebral artery that did the strategies. And like Dr. Kelp said before, that he sees reversing in the eyes and the vessels of your eyes. The eyes are the window to the brain and the window to the body. So here it is. The middle cerebral artery got better from February 2017 to November 2017. Same patient, February 2017, November 2017.
Wow, that's impressive.
Really amazing. That's really amazing. So reversing visceral fat, reverse chronic disease, reverse inflammation, improve vascularization, improve your fatty liver, reverse your fatty liver, improve liver function, improve pancreas function, and improve your life. It's not suffocating you anymore, right? Your organs can breathe. Oh, I am finally myself again. Your liver can say, yes, I am normal.
So if you want to go and ask your doctor to get an MRI of the abdomen without contrast, how many slices should somebody get, and how much would it cost if they're going to pay out of pocket?
So nowadays, right now, that's why we need to become a bigger voice, and we really need to be the voice for each one of us, spreading this movement of health and reversing visceral fat. Because right now, since we were not taught in medical school, chances are your medical doctor your doctor is not going to order you an MRI unless you have some major reasoning, like bad liver function tests that he might want to check for liver fat. fatty liver disease, but he might even start with the ultrasound. So your insurance is probably not going to pay, and your doctor is probably not going to be on board. I hope, my intention is that it's going to become a movement, and we're going to be able to approve a visceral fat MRI protocol, or, you know, whatever name they would give for that. Because we have screening for so many diseases. We have screening for lung cancer, prostate cancer, breast cancer, colon cancer, you know, for hereditary cancer syndromes. We even have the cancer screening from pre-nuvo that it's paid. So I think that we have to back up. You know, we really have to back up and understand that. I believe, not I don't think, I believe that we have to back up, because if the root cause, if the major root cause of all the things that we are screening is visceral fat, the point is, how could we screen for visceral fat and attack the enemy before it becomes the cancer, the lung, the prostate, the breast, the colon that we are going to detect with other screenings. So if visceral fat is the first step, or at least one of the first steps, I have to start here on visceral fat. So I firmly intend for people to understand, and doctors and corporations and the government and the military, for them to understand that we have to start with screening visceral fat. And the best way to screen visceral fat is the MRI. And that's what Sean is trying to spread with his word as well. And that's what we are doing here, you and I. So we start with the MRI, and then detect visceral fat, implement the strategies, and we are going to be spending money in the first step, and we are going to save money and save quality of life and save quantity of life, preventing diabetes, preventing dementia, preventing these cancers that the visceral fat is a precursor of them to develop. So right now, we do not have doctors ordering for visceral fat MRIs unless you see Sean, and that's something that you should definitely think about, because it's life-changing, and it's definitely life-changing. And we do not have protocols for visceral fat MRI screening. So if you are having an MRI, you would have to pay out of pocket, and you would have to have the whole MRI exam, and most definitely the radiologist is not going to say anything about visceral fat in your report. And that's why I'm saying that it's good to have a doctor like Sean, or it's good to learn to look at the visceral fat by yourself. I have discussed that on my Instagram. I'm teaching people how to look at your visceral fat. You're not going to learn how to read an MRI, but you're going to be able to see a little bit more the visceral fat on your own body if you have an MRI or if you have a CT scan. And let's hope that radiologists will come on board sooner than later and start describing visceral fat, fat in the liver, they already described, fat in the pancreas, they already described, but also start describing fat in the muscles. I am already doing that with my own patients, and I also put in the impression, because I know that radiologists are a huge source of information and guidance to providers. We are the doctors from your doctors, right? So I give guidance saying that the constellation of findings, fat in the liver, fat in the pancreas, fat, visceral fat, mediastinal fat, fat in your muscles, all these findings are correlating with a wide range of metabolic issues, and that they could be reversed with lifestyle changes such as no processed foods, low carb foods, high intensity training, fasting, strength training, and sprinting. So yes, of course, I look at the age of the patients, and I also say that these strategies should be discussed with your provider, because I don't want to put a person who has severe vascular disease and severe coronary artery calcification and narrowing to do sprinting, right? That's not my point. I think that you have to start slowly, and you have to start on what you feel comfortable, and you have to start with the approval of your medical doctor, jumping together with you and walking this journey as an accountability partner with you and for you. And the price is variable. There is a website called Radiology Assist, and you could search for yourself for your region where you live, and you should choose the MRI abdomen, upper abdomen, or superior abdomen without contrast. You do not need any contrast to check visceral fat. The contrast is usually needed when you are looking for inflammation, or you're looking for cancer, or you're looking for other issues in your abdomen. But for visceral fat only, or for fatty liver only, you're not going to need IV contrast. And I've heard that in Las Vegas, you could have an MRI for $240. Here in Minnesota, and in Nebraska, you could have an MRI for around $400 or $500 in the radiology assist. I would strongly recommend that you get the price, and then you call the place you are willing to go, and you say, hey, I want to do this scan, and I want to pay cash, and I'm paying out of pocket. How much could you make it for me? Because I have heard people negotiating and getting this price coming lower. And remember that you're not going to be doing this frequently, so you're going to do an MRI, and then you're going to see your baseline, and then you're going to start doing the strategies, and you're going to repeat like in 9 months, in a year, to see how you're doing, because you have to give time for your body to heal from the inflammation, and then start decreasing the visceral fat, and then start building muscle. So if you are investing $500 now, think about like how much it would be in 10 months, because if you dilute in 10 months, because that's most definitely when you probably are going to repeat it again. And again, remember, your body is your major asset. Your health is your wealth. Your health is an investment, not an expense. And connect to your why. How do you want to be in 10 years, in 20 years? Where do you want to be in 10 years, in 20 years? What do you want to do with your life in 10 years, in 20 years? Because if you keep accepting visceral fat as normal, you are going to decline your quality of your life. You are going to decline the quality of your body, because you're going to have a chronic, long exposure to inflammation over and over and over again, with development of cancer, with development of diabetes, Alzheimer, autoimmune diseases. Sean has clients that have a diagnosis of multiple sclerosis, and they are now with their multiple sclerosis controlled, and some of the lesions have completely disappeared. He has, and I'm sharing because they share with all of us, patients with cancer, that the cancer is on remission or the cancer is stable. And I can say for myself, my insulin now is normal, 2.6. My glucose is normal, 76. So I can say for me, and I can say for friends and family who are doing that triglycerides levels are getting better, insulin levels are getting better, and the shape of the face, and your body, your muscles, your energy, the clarity, the cognition. So yes, you have to invest on yourself. It is expensive, but it's way more expensive to get sick, because after you get sick, you don't come back.
I think if enough people ask for it, the price could come down, like calcium score. And I interviewed Dr. Phil Ovadia, and we talked a lot about calcium score for risk of heart disease, having a heart attack. And most places you get a calcium score for $99.
Yes, exactly.
So if enough people are asking, the price could come down to $99.
MacuHealth, your science-born and tested solutions for visual performance, macular degeneration, and dry eye syndrome. New products coming soon. Embrace the science.
Is there, as a radiologist, you would probably know this, is there a cost to doing the test to the center, or is it just manpower? But is there any material cost to doing an MRI that the center, it costs the center every time they do it on anybody? Is there any kind of cost to them?
I do not know about the costs. What I know is that the MRI without contrast, you're going to use the time of your technician and the machine by acquiring the images, and then you're going to get the report from the radiologist. I do believe that if Las Vegas is offering an MRI for $240, I doubt that they would be not getting some kind of profit. So I agree with you 100%. I agree that if you start asking, if the followers start asking and demanding and having and talking about it and having the studies done, the scans done, the same way they brought the coronary artery calcium scoring for $99, they might be able to get the MRI for 240 everywhere, or even 200, which is kind of reasonable considering the price of everything in medicine right now. And it's kind of reasonable if you consider that you're going to repeat in a year. So if you divide 244 in a year, it's almost like you're paying $100, right?
Right. Now, talk about a DEXA scan or bioimpedance, how that could help with diagnosing visceral fat. We know the DEXA scan for bone density, and it gives us our total fat percentage, but how does that help with visceral fat?
So here we have.
It's called a DEXA scan and bioimpedance.
So the DEXA scan and bioimpedance it has its value, because some people cannot afford an MRI, so it's going to have its value, right? However, again, it's mainly giving you numbers, and it does not show very well the anatomic distribution of the fat. And yes, it might say you have 4, whatever, suppose, like me here. This is me, okay? This is me 9 months ago. So body fat, 44% of body fat. And then it tells me that I have 2.1 pounds of visceral fat. And yes, I am towards the higher risk, which I believe I should be way more. I should be right here because I have severe visceral fat. So this number, 2.1 pounds or 44.
And this is a DEXA scan? This is a DEXA scan?
This is a DEXA scan, bioimpedance scan, yes. I'm showing the portion that was talking about the body fat only. So the DEXA scan is really good when you want to check bone density, because that's the only way to check bone density. And that's important because you do not want to be in the osteopenic side or osteoporosis side. And again, by doing the strategies in improving your muscles, you're going to be improving your bones too. But
there is some radiation with the DEXA scan, is that correct?
Very minimal, but there is some radiation with DEXA scan. It's very minimal. So again, it's a number, 44 and 2.1. And I ask you, if this is you, but if this is you, when you go home, what are you going to be thinking that you need to take action? 44, or when you have this image hitting your face here, fat in your pancreas, fat in your muscles, and all this ocean of fat surrounding your organs. What are you going to remember more? The image or the number?
Let me ask you about love handles. What kind of fat is love handles? Is that deep subcutaneous fat, and is that bad fat? And could people have love handles? Is that a sign that they got to start making a change?
Yes. Love handles are a mix of deep subcutaneous fat, are made of a mix of deep subcutaneous fat. And if you have love handles, most likely you're going to have a good amount of visceral fat as well, because you want zero visceral fat or minimal visceral fat. So any amount of visceral fat might be severe, because a small amount of visceral fat for you might be damaging to your body by producing inflammation, in the same way a large amount of visceral fat is producing inflammation for me. It's not about, and that's why you are your N1, you are your own case, because it's not about comparing the amount of visceral fat from me to you. It's about okay, this is the amount of visceral fat you have, Anna, or suppose this is you. This is the amount of visceral fat you have, Dr. Gelb, and that's important for you. That's the inflammation you have in your body. That's your unique problem. It's not like comparing with other people. Like, it's not like comparing bone density. Bone density you compare in the average of the population. Yes, you could compare visceral fat in the average of the population, but everybody's sick because 95% of the people are sick. But you don't want to compare with anyone. You want to improve your health. You want to improve your life. So you are your own experiment.
How about the poor man's way of doing it at home? Waist to hip ratio or sagittal abdominal diameter?
So the waist to hip ratio, there are studies that show that they correlate the higher the waist hip ratio, the higher the incidence and prevalence of pancreatic cancer. So yes, the waist to hip ratio will give you some kind of knowledge regarding, some kind of information regarding the amount of visceral fat you have. But again, you're not going to be seeing the quality and the quantity, the quality of fat. Like we just talked about people that the pears and apples body shape, right? They might have waist to hip circumference ratio abnormal or normal, but when you do the MRI, you're going to see, hey, like, hold on. If you go to me, no, this is not me, thank God, because this person has an abdominal aortic aneurysm, and I don't want that. So this is me. I already have an oval-shaped abdomen compared to the protuberant-shaped abdomen, so it's better. But this is me. Suppose that we measure, my waist to hip circumference has not changed very much. Why? Because if you look here, I decreased visceral fat, but look at my subcutaneous fat, both of them, the superficial and the deep. It hasn't decreased very much. It decreased, but it hasn't decreased in the proportion that my visceral fat decreased, as you can see. See here, like if you look here, look at just the subcutaneous. If you look at the subcutaneous here,
right,
and you look at the subcutaneous here, it decreased, but not much.
Right.
But if you look at the visceral fat, look at this distance here, okay? And you look at the visceral fat, look at this distance here. So my visceral fat is still severe because you want none, right? But it decreased in an amount that it improved more than the subcutaneous fat. But if you do the waist circumference ratio, since I haven't lost this very much, and I also have lost fat in my hip, it has not changed much. But now I know that I am better with visceral fat. So that's the value of the MRI. The MRI tells me, hey, anatomically characterizing you, you still have lots of visceral fat, but it improved a good amount. You still have lots of subcutaneous fat. They have not improved much. And that's why it's not changing in your waist hip circumference.
And I guess that would be the same for the sagittal abdominal diameter?
Yes, most likely.
And that's when you measure from the, like around the belly button to the middle of your back?
The sagittal abdominal diameter might be a little bit better because it's measuring from here to here, right? Oh man. From here, from the back to the front, from posterior to anterior or from anterior to posterior. So if you are laying down in a hard surface and you measure that, then that might be a better measurement that you could follow, because the visceral fat gives you a protuberant abdomen. It's like the belly standing up, right? While the reversing visceral fat gives you a more oval-shaped abdomen. So you see the shape of this abdomen is more oval than this abdomen, more triangular, protuberant. So that would be the AP or the anteroposterior diameter or the sagittal that you are calling. But again, I will know that it's decreasing in measurement. But if you repeat in a year, it's very motivational to see that it definitely decreased. And yes, it's a journey. I still have lots of things to do, but I will have lots of things to do for the rest of my life because there will always be room for improvement, right?
And I know people a lot of times like to take the easy way out. How about liposuction? What happens if they go for liposuction? What fat are they removing?
The superficial subcutaneous fat.
The deep and the superficial.
The deep and the superficial, but mainly the superficial, right?
So they're removing the good. They're removing the protective fat, and they're actually could be hurting themselves because they're not going to be getting the adiponectin. And something that occurred to me, and tell me if this theory makes any sense to you, because I could see from your scans the superficial subcutaneous has gotten bigger along with the other fat. So the superficial is getting bigger as a protection against the bad fat. So if you take away the superficial, you're going to be looking at getting sick because you're going to lose those good hormones.
Yes, absolutely. You are going to be losing the protection against inflammation and the protection against high glucose and the protection that decreases insulin and protects you from cardiovascular disease. And you're going to be leaving the source of inflammation in your body, which is the visceral fat, and then you're just going to get even worse, right? You are absolutely correct.
Now, is there any other slides that you want to show us before we go into I want to start, even though you've mentioned it along the way, the treatment, I want to get into the treatment in an organized way so people could have it at the end. And you mentioned Sean a lot, that's Sean O'Mara, O-M-A-R-A, to go to some of his material that the doctor has been recommending, Dr. Rosa.
So I just want to show one more here. I want to show that this is what visceral fat leads to your body. So again, the protuberant abdomen, impaired glucose tolerance, insulin resistance, type 2 diabetes, dementia, which is now type 3 diabetes, brain atrophy, vascular disease with stroke, vascular disease with hypertension, heart failure, myocardial infarction, arrhythmia, particularly atrial fibrillation, respiratory diseases, bone density, polycystic ovarian syndrome, cancers. Lots of cancers are related to visceral fat. So again, I urge people to start talking and spreading this as a virus, like we had the COVID pandemic, now we have the obesity pandemic. Let's just spread the knowledge and spread the movement against the obesity pandemic as if this knowledge is a virus. Let's just infect everybody with this knowledge and the wish and the will and the hope to change, because instead, and I'm, not instead, but let's go back. Let's do 2, 3, 4 steps backward. Instead of treating diabetes, let's do an MRI screening for visceral fat and reverse visceral fat. Instead of having people developing dementia in 2050, we are supposed to have 13 billion people with dementia. What a sad situation. You don't even know who you are. What's the point of living like that, right? So instead of having diabetes type 3 or dementia, let's screen for visceral fat and reverse it, because there are studies proving that the changes in the brain start 10 to 15 years before the first episode of memory loss. And these changes are from inflammation, amyloid, and tau proteins that come from visceral fat, stimulating this bad environment. So let's work in reversing visceral fat so then we can improve our brains, improve our cognition, improve our eyes, atrial fibrillation, all these problems like women in menopause, women, open your eyes. You have this beautiful pear-shaped body, and when you get into menopause, that you lose your estrogen, that you lose your progesterone, what happens? You become an apple, and then you have all this amount of fat in your mid-waist, in your belly, and that's visceral fat. You do not want that. You do not need that. You know what? Not because you're getting ugly. It's not because you're getting ugly. It's not because you're getting fat. It's because it's inflammation, and it leads to, and visceral fat releases a substance called aromatase, and aromatase is going to get one of your adrenal hormones called androstenedione, and it's going to transform it in a form of estrogen called estrone. And this is horrible because this is stimulating cancer in your body, breast and endometrial cancer. So open your eyes, take action. You want to be a wife, you want to be a grandma, you want to love your grandkids, and you want to be active with them. Reverse your visceral fat. And that's what I'm saying. Instead of having, not instead, but adding to having breast cancer screening and cervical cancer screening, we definitely should have visceral fat screening, because then we can attack the root and then we can prevent the consequences. Yes, and we're going to decrease the money that we use for all these diseases in, palliative treatments. I saw my husband dying from colon cancer. The chemotherapy, yes, it like gives you more years, but doesn't give you more quality. So let's work towards a future that we're going to spend less money in disease and we're going to spend more money in health, in life, in living, right? And that's by reversing visceral fat. Let's advocate, let's spread and talk out loud about a visceral fat MRI screening. Anyway, that's what I wanted to say, and you wanted to ask about the strategy. I talk too much because
You talk great. No,
it's my passion. It's my passion.
I love
because
it.
I
I
want to
love
reverse
it.
it in me.
I really appreciate it. Thank you so much. And I want to ask you about the treatment now. What do you think about the semaglutides, the Ozempics, the Wegovys, the Mounjaro, the GLP-1s? Do you think there's a place for them, and will they help us lose visceral fat? Or do we know?
I'm hearing a lot about them. I would have to do more research about this. I know that it helps with insulin resistance a lot. I know that it improves liver function as well. I know that they could be used, but they should be used in conjunction with strength training, sprinting, and high intensity exercises, because then you're going to be preventing the muscle loss that is related to these medications. And one thing that I would definitely say, it's like the medication could propel you to get the results faster, and it's awesome, especially if you are stuck like me. However, sometimes you feel stuck like me because of the stress. You have to see the images and see, oh, yes, I'm getting better. Otherwise, you feel like, oh, my God, it's taking so long. However, what I would say is that nothing is a miracle. Not even the strategies are a miracle. The miracle is you. The miracle is deciding to take the action, deciding to implement the changes, and really making new decisions. It's like scheduling for yourself, scheduling the time that you're going to prepare your food, so then you are not trapped in foods that are not healthy or fast foods. Scheduling the time for you to go to the gym, scheduling and do the strength training 4 times a week. Schedule the time for your sprinting. Schedule the time for your cold showers every day, 20, 30 seconds after you finish your shower. Schedule the time for saunas as much as you can, 15 minutes. Make sure that you wake up early and you go see the sunrise and you go see the sunset. No medication will have a long-lasting effect if you do not change who you are. The medication will help you in accelerating your results. It might give you more motivation. I don't know about the side effects. I do not work with medications. I am a radiologist. However, I would say no medication replaces. The medication could be an adjuvant, like adjuvant chemotherapy, decreasing the size of the tumor so then you can operate. But so the medication can be an adjuvant, but the medication is not going to do the work for you. You have to do the work, because if you're going to stop the medication at some point, you have to have changed who you are, not what you do. You need to change who you are to keep doing these strategies. It's not about implement the strategies and just do them because you have to do them. You're going to do them because you're going to become them. They will be the life you want for you.
So I'm going to see if I could summarize the treatment, and if you could jump in at certain times, but I think we've covered a lot of it. So number one is we want to decrease inflammatory foods and decrease processed food inflammations such as sugars, artificial sweeteners, seed oils, alcohol, gluten, refined carbs, chemicals, trans fats, MSG, GMOs, fried foods, high sodium foods. Is there anything on there that I left out?
No, you added everything. However, I would say you want to decrease to a point that it will be 0. You don't want any of them. And you have to care about your water too.
And we want to eat, and the foods we want to eat are real foods, like grass-fed, grass-finished meats, organic chicken and turkey, some good fats, avocado.
Yes.
Do you cooking in coconut oil or butter?
Yes.
Is that okay?
Yes.
Avocado
is controversial because lots of people say that avocado has lots of preservatives and toxins too. But again, I'm not here to tell people don't do this, don't do that. Do what you feel comfortable in a way that you're going to keep it, that you're going to keep doing and improving and improving and improving. Yes.
And as far as running, sprinting is far superior than jogging because
Sean used to be a runner, and he says that running people are addicted to running from the feeling good. The
endorphins.
Yes, endorphins after you do it. But stop running and start sprinting.
Because
sprinting also releases all the good endorphins that you need. And it's going to make a huge difference in reversing visceral fat and building muscle, fast twitch muscles.
And how long, somebody that's older, they can't just start sprinting. So they have to be able to get into it gradually. You don't want them pulling muscle.
Most definitely.
Pulling.
And also for the running people, I would say, if you like the sensation of being in nature, running or, hiking, just do it by walking. Walking has, you do your sprinting and then you do everything else you like to be in contact with nature by walking. Because walking has been proven to be excellent in everything. For the people who are not able to walk very much because they already have lots of peripheral arterial disease, I would say, if you walk around your house, that's better than nothing. If you walk 1 block, that's better than nothing. And slowly you could keep increasing, because then you're going to be building collateral circulation in your legs, and you're going to be getting better to walk without pain. For the people who cannot sprint, I would say what Sean says, and I would watch his videos, most definitely. Start slowly, start uphill, get warm up before, and start slow speed, and then you increase the speed up hills and do the amount you can. And when you get tired and you get winded, just stop. And then one important thing to remember that I did not know and I learned it from him is when you are winded because you sprinted and you are in the resting time, do not rest walk while you are resting. Keep your body moving while you are resting in between sprints, and also breathe in and breathe out from your nose. Do not use your mouth. Breathe in and breathe out as much as possible from your nose, because it increases even more the production of nitric oxide.
Yes, we just did a podcast on proper breathing. Sunshine is important. Safe sun.
Sunshine. Sunset, sunshine, 3 minutes of sunrise, 3 minutes of sunset, protecting your eyes, not looking at the sun when it's hurting your eye. So if you're looking and it's hurting, you are already out of time. You do it tomorrow when the sun is not hurting your eye for at least 3 minutes each, and it will definitely improve your circadian rhythm. And sunshine at least 15 minutes a day. So do it while you are finish eating and go outside for 15 minutes and walk in the sun. You're stacking strategies. I think that stacking strategies is awesome. So you'll be walking and getting your sun together. 2 strategies.
Optimize the microbiome.
optimize the microbiome with the nourishing foods we talked and with the fermented foods and veggies. And Sean says when you are eating fermented foods and veggies, they are a garnish. They are not supposed to feed you. They are just a garnish, like a mustard, like mustard, right? And so you put a piece of beef in your mouth and you put a little bit of the fermented and you chew them together and you bite them together and then you swallow. Don't eat them separately. Try to eat them together. And that's what he teaches all of us, and he teaches in his videos as well. And it definitely leads to improvement in your microbiome.
Right.
And I would definitely recommend watching his YouTube, watching his Instagram, following him, becoming his patient. It's whatever it works for you, you're going to be learning and changing for life.
Right. Whole foods. If you're going to eat fruits and vegetables, it's got to be organic, good sleep, grass-fed, grass-finished meat, strength training.
Strength training at least 3 to 4 times a week. Again, you are doing until you get tired, until you can't do it anymore. For muscle building, muscle is good for your brain, muscle is good for your memory, muscle is good for your bones. Muscle sustains you. Muscle is the ticket for independence in while you age. Yes, strength training.
And fasting. Are you a fan of fasting?
Fasting. I am definitely a fan of fasting. And fasting, I fast every day, at least 16 hours a day. And Sean,
what are the hours that you fast? When do you eat and when do you fast? Because I have strong feelings on fasting.
I ate yesterday at around 2 or 3 p.m. And as for now, I am at 22 hours of fasting.
Wow.
But I usually do 18. But usually I finish eating around 2 or 3 p.m. because the good thing about eating is when you finish eating before it's nighttime, while you still have the sun, that's the good time for eating. So I ate yesterday and now I'm going to eat again. And I'm trying to do 36 to 72 hours. I don't do every week. He advocates for every week, but again, you start slowly and you implement it. Otherwise, you're going to give up and you don't want to get sluggish, right? You want to have energy. So usually I go up to 24 to 36 hours. It's not very difficult. Then it gets a little bit difficult up to 48 hours, and then it's easier. So the longer you fast, it's weird, but the longer you are in hours of fasting, it gets easier. And extended fasting is really good for mood, for dopamine, for endorphins, for brain memory, and for energy, and for repairing cells and your immune system. For women, I like the book from Dr. Mindy Peltz. She talks about fasting like a girl. If you have your cycle, or if you are already in menopause, she teaches like different kinds of fasting that match the cycle and are really helpful for women. I would recommend that. It's called Fast Like a Girl.
And fasting increases nitric oxide and increases autophagy, which you're talking about, the cleaning of the body. Why is nitric oxide helpful? If you could explain that.
Nitric oxide is helpful because it's what you use for vasodilation and improving circulation in your body. So when you are improving with your strategies, you're going to see more visible pulses in your arteries and your veins because you are improving the circulation, and you're going to see that your lips are more reddish and your nails are more reddish, and you have better skin recovery, the skin turgor, you know. So everything is related to circulation. And if you improve your circulation, of course, you are improving your muscles, and you are improving how you are walking, and you are improving like your vision. You are improving everything because the organs need blood, right? So nitric oxide is for that. Like when you are having angina or when you are having a heart attack, one of the substances that we use is nitroglycerin, which is related to nitric oxide, to open the vessels and make the flow better oxygenation to your body.
cutting alcohol. We talked about
cutting alcohol.
sunrise, sunset. But from the optometrist, don't look at the sun. We don't need any macular burns. Sauna and cold therapy. Heat shock, increased nitric oxide, also sauna.
Yes.
And
Yes.
heat shock proteins. If you could talk about heat shock proteins, maybe, and how it how sauna, I guess there's infrared versus Finnish. Now I'm not sure if you know much about the difference, but I saw studies where people that do sauna 4 to 7 times a week or 4 to 8 times a week lower their risk of a heart attack by about 50%. I had a sauna in my house, an infrared sauna, not a Finnish sauna, and I thought it was a very helpful strategy. I was wondering how you feel about sauna.
So I have a sauna in my house too now that I got it for me. I got the Finnish because that was the one that Sean indicated for me, and I love it, and it definitely helps with stress, and it definitely helps with eliminating toxins. It cleans your body, right? And the heat shock proteins decreases stress, and it's a hormesis technique, and it helps with sleep. It helps with calming your nervous system. Yes, so sauna, I definitely advocate for that. There are different studies saying the amount of sauna you would have to do, 15 minutes every day. I do not follow a specific protocol. I want to go and start doing it at least 4 times a week, 15 minutes. Right now, I'm not doing that much.
15 minutes?
15, 1-5,
15,
yes. Right now, I'm not doing every day, but when I do 50 minutes to an hour. So I try to compensate with the time because I really love to just be there and relax and think about life and reflect and pray and meditate and practice gratitude. I'm stacking strategies, right?
And how many degrees do you use it at? When I did infrared, I used only 130 degrees for 30 minutes.
So the Finnish sauna, I put 174.
Oh, okay. That's much higher.
Yeah. I do not know about the infrared sauna. I am not sure if the infrared sauna has complications or not. I chose the Finnish sauna because the information I got is that the infrared hits your body from inside out, and it hasn't been completely proven that it wouldn't be a problem for your cells and the nucleus of your cells or your DNA. I don't know. I might be saying something dumb. So I'm not completely sure. The Finnish hits your body from outside in, and I really love the sauna. There is some people use red light therapy for inflammation, red light therapy for boosting your mitochondria. I don't see that in Sean's strategies, but I have heard and read about this as well. What else? And cryotherapy. I really like the cold showers, and I really like the cryotherapy that I get inside the freezer in the clinic, and I stay there for 3 minutes at -200 and something Fahrenheit, and I'm like, oh my, but it's so good. You get out of there and you're feeling this huge amount of energy, and yeah.
Are you capable of doing cold plunges, or because I can't do that? That's too much for me, cold plunges.
I've started doing cold plunges last week, and I'm really liking it, but I'm doing it at 60 degrees Fahrenheit, so I'm still adapting my body. I told myself, I tell myself that healing is 3 C's: commitment, consistency, and compassion. If I don't have compassion for me, I'm not going to stick to commitment and consistency because I'm going to give up because it's stretching me too much. So I do my best, knowing that if my best is 30% that day, it's 100% for that day. But I keep with my commitment and my consistency. So if you tell me, oh, you have to start the cold plunge at 47 degrees, I know it's going to be too hard for me right now, and I know I'm not going to stick to it. So I Googled and I said, and I saw the maximum is 60 degrees. And I said, I'm all in for 60 degrees. And when I am getting more comfortable with 60 degrees, I can put 55. Because like Andrew Huberman says, The cold therapy is you choose the temperature that you are able to stay 2 to 3 minutes feeling uncomfortable. When you start feeling comfortable, that's when you have to decrease the temperature. If you are able to stay only 30 seconds, that's what you are able to do that day. That doesn't mean you're going to be doing 30 seconds forever. That means you are adapting and adjusting. And it's better to do 30 seconds at 60 degrees than do nothing and never start, right? So be compassionate to yourself, and then you can be committed and be consistent and be your best partner and best friend.
Back to the heat shock proteins, I mean, these are repair proteins that are released by the cells when the body's under stress. And that's why sauna could be very helpful. Dr. Rosa, you're amazing. You have so much knowledge. You're an MD, you're a PhD, you're a radiologist. You work at the VA hospital in Nebraska. You help so many people. Is there anything that I left out that I didn't ask you that you want to talk about?
No, I think we covered a lot of things, and I'm very grateful for you being so helpful and contacting me, because I believe this is something that needs to be spread all over the world. And I'm very grateful that I am on my journey as well, and I'm reversing my own visceral fat. Like I say, getting better and better every day in every way. And as a radiologist, I should say that I have my memory pictures because I am a radiologist. Everything is a memory picture, right? And my memory picture is that all of us are holding each other and walking this journey of healing and health and life together. And we are borrowing energy, we are lending energy, and we just keep getting better and better. And we have to bring this knowledge and spread and advocate, because I want to show this. A candle loses nothing by lighting another candle. And what I tell myself, and I tell the people who follow me on Instagram, because I have a community called Radiant People, because radiant people, and we are supposed to spread the radiation from our souls around the world. And what I say is that when you go to a dark room, it's so dark. But if you light one candle, or just the thing that lights the lighter, right? If you light a lighter, or if you light one candle, you cannot see the end of the room. You might not be able to see the door, but you see enough that you can give one step forward, and then you see enough that you can do one step forward. And that's what I tell everybody. It's not about overwhelming yourself, because otherwise you're going to be increasing cortisol. It's about lighting your lighter or lighting your candle together with me, together with Sean, together with Dr. Bell, and give one step at a time. And when your candle illuminates a little bit more, give the next step, and keep giving the step and walking this journey, because it's a journey. And when we finish, we are all going home, and we are all going to be healthy. Yeah, like the Costa Rica patients, 102 years old, healthy and happy and joyful and grateful. Yes.
So, if people want to follow you, you mentioned your Instagram. Can you say it again? And where else can they follow you? Is there a Facebook, or where else can they follow you? And because you're in the VA, can someone become a patient of yours? Or if they want to, they should become a patient of Sean?
They should become a patient of Sean. I am a radiologist at the VA, so I only see veterans, and I do not see veterans. I see their images, their CTs, MRIs, X-rays, ultrasounds, DEXA scans. That's what I see. I am the radiologist, the doctor of the doctor. And Sean is the doctor of the clients. And I would definitely say that you should follow him and be a patient of him if you can, because it's going to be life-changing. It is life-changing. Follow, learn. I am on Facebook as Ana Cláudia Rosa, or Ana Rosa Radiant Red. And I'm going to send it to Dr. Belk, so then he can put on the podcast information too. On Instagram, I am Ana C. Rosa _red. And I do have a YouTube channel that I started sending my videos. I don't do videos only about visceral fat. I believe that to heal our body and build an optimal life, it's body, mind, spirit aligned with the soul. So I talk about everything, and I talk about life, Yeah. And I invite you to come with me.
And your YouTube channel is under your name?
Ana Rosa, yes, Ana Rosa Radiant.
And before we got on, we talked a little bit about macular degeneration, and that the supplement is MacuHealth, also omega-3s and a good multivitamin and a D3K2. Just make sure you get your vitamin D checked. But Anna, Dr. Rosa, I want to thank you so much for joining me today. You're amazing. You gave us so much information, and you're going to help a lot of people about a new biomarker that people have never thought about, but they need to ask their doctor to know about this biomarker. Even though 95% of them, it's going to be bad, they could just go right to the treatment, but this way they could quantify and know if they're getting better.
Take action, be your own advocate. And yes, visceral fat is the biomarker, is the root cause of almost every chronic disease, and you can check yourself. Like I said, if you have any kind of health issue, Google today, look at ChatGPT, and you're going to say whatever you're feeling plus visceral fat, and you're going to figure out that you're going to discover that visceral fat is the root cause analysis that you are looking for and need to attack to get better. And I wish you all health and light and life and peace. And I am so grateful to be of service, and I honor and respect each one of you with all my heart.
Thank you so much, Dr. Rosa. Hopefully you'll come back and speak with us again.
Awesome. Thank you so very much.
Yeah.
Your eyes and your vision are under attack, damaging blue light from the sun. Your phone, your computer, your tablet, even light bulbs and car headlights is constantly bombarding you. The good news is our eyes actually already have a line of defense to counter the effects of blue light. This defense is made up of 3 pigments called carotenoids. MacuHealth with Micromicelle, the only supplement with the exclusive patent on all 3 macular carotenoids and Micromicelle technology.
Fitting multifocal contact lenses presents a big opportunity to meet patient needs while growing your practice. Alcon is your partner not only with our innovative portfolio, but through e-learning. Learn to enhance your multifocal strategy today with the Alcon Experience Academy.
OIE Broadcasting is the emerging leader in social media. We use scientific entertainment to drive more patients into your office. Visit oiebroadcasting.com and sign up today.